न्यूरो ज्ञान यूट्यूब चैनल पर आपका स्वागत है। लेटेस्ट वीडियोस के लिए अभी सब्सक्राइब करें।
Now may I request Dr. Ravi Ramakantan, a former HOD and Professor Emeritus of Radiology, to grace the dais and speak a few words.
There comes a time in one's life, you go through the last 10 speeches that you're given. One is about the start and finish of interventional radiology in India. The other one is philosophy of radiologists in the era of artificial intelligence. Things like that. Philosophy, history, geography, so on and so forth. And then you know that you are an old man. Not only that you're an old man, but you're so powerful that you have to be given something to talk on. And it cannot be on the subject. That means that you do not know the subject, you're an old man, maybe you're a nice guy, and we are giving you a talk. And I'm going to talk to you now about the whole thing, how it started. How did the concept of medical humanities come into KM Hospital? Now, this history business is very interesting. And someone told me, someone very wise told me, history is the viewpoint of one individual. It does not mean that that is true history. So what I'm going to do now is talk in I, me, myself now. And that's my perspective of, in some way it is true that this is how humanities sort of started in KM Hospital. The only reason I'm showing this slide is that in radiology, it's generally believed that it's a non-clinical subject. It's true that we don't treat patients with drugs and pills, but we see patients all the time. In fact, it's a proved statistics that the department which has the largest footfalls of human beings is the radiology department. We may not interact with them closely, but we see human suffering in a way that many others may not be seeing. So I have been influenced by that and also by my teachers, and I'll come to that in a little while. And therefore, the credo of our department on the website is patients first, not images. And I have a website which says patients, not such images. Why am I saying this? 25, 30 years in radiology in KM, in association with or being exposed to teachers. That's the whole thing. The whole thing of what you are revolves around your teachers. And if you are a teacher, you are aware that you're going to influence your students that way. Two people, both non-radiologists, who have immensely influenced me in different ways, Dr. Manu Kothari and Dr. Sunil Pandya. The only thing common between them is that both of them are Gujaratis. Both of them are on the second floor. One called the other Sunil and the other called the other Manubhai. And they talk to each other in Gujarati and I get angry. I pretend I don't understand Gujarati because my wife is a Guju. So, Supe referred to Dr. Kothari's office and I called it the intellectual watering hole. When you're a radiologist, you're jobless most of the time. And I have this masterly act of being very busy without doing any work. So 1 o'clock or 2 o'clock or whatever time, I run up to the second floor and go and meet Dr. Kothari, because the moment I enter that room, he picks up the phone and says, "Canteen, Ravi Saab ka chai." So I get Phukat ka chai. That's incidental. The real thing is that over time, he has not taught me at any time, do this, do that, do that. Nor has Sunil Pandya. Both of them led by example. And that is why they are both great teachers. They did what they wanted others to do without telling the other guy, do this. That is a true hallmark, I repeat, of a great teacher who leads by example. So somehow all of this came together at a completely unrelated incident. In 2008, we had a school reunion in my school 40 years after we left. And then I met a whole lot of people who are non-doctors. And then I realized that not just doctors, but there are smart people who are not doctors. And as Apoorva said, you mix them with the rest of the cultural world, the rest of the world that you thought never existed. And there was a friend of mine, her name is Radha, and she is a doctorate in English language, but she does theater work. So she and I discussed many things across many subjects, and I realized that it's possible for doctors to work with the arts in such a way that it promotes interpersonal communication. That's the main thing. It's all about interpersonal communication, understanding the patient understanding the doctor, and the most important of all, the doctor understanding himself or herself. So in 2000, all of this happened in the second half of 2001, and I retired at the end of November. So in the 4 or 6 months of my last day at KEM, that's after 40 years of KEM, I started working on this, and I told you, I warned you, this is I, me, myself. So one day I said, let's do something about this. I mean, there are some backgrounds to it, I'll not get into that. And I walked into the dean's office. Dr. Sanjay Oak was the dean. So I go into his office and I say, sir, I want to talk to you about something. He's signing papers. And he said, he half listened to me and he said, Ravi, tula je paje tu kar. Don't increase my headache. Now when the dean says, tula je paje kar, in his own perfect Marathi, I said, this is it. I got the permission from the dean to work with medical humanities, create a cell in medical humanities, and I wanted a Bakara who will take over the work. Somebody has to do, I'm going out. Now, the other thing that I have mastered is to be on committees, but not in the executive committee. Never a secretary, never a president, nothing. When you heard this, the best coaches are in the stands. Have you heard this? Everybody gives expert comments on what's going on in the field. So I said, at 9:30, next slide, is there a next slide? Who will do it for me? Yeah, look at this. I mean, this is another important thing I learned from Dr. Pandya. Document everything. There is an operation note somewhere where he wrote, I got cramps in my right hand, therefore I asked Dr. Markpal to take over. This is operating notes. I cannot forget that. So I got this habit of documenting everything, and that night at 9:30 p.m. on a Wednesday afternoon, it's a Wednesday evening, I wrote to Padmaja that the dean has said, okay, do something. The other thing that you learn in BMC is that everything is talk to me in writing. You heard that phrase? Talk to me in writing. Everything has to be in writing. So I told her the things, you do this, do this, do this. And eventually she has a document, I think, where the dean said, okay, go ahead and do something. And then a few days later, there was a meeting. I'm going through these slides because there is a chronology. You start something, you have to follow that up. I'm already on the way out. I don't want to take credit for any of these things that is happening. Is my name here? No. Why? Because the photographer is never in the picture. You heard that? The other thing is, the most important thing is the last line. How many of you know Dr. Nitya Gopte? Now she has mastered the fine art of the last line. Send apologies. I am so sorry I cannot come. No. I am so sorry I cannot come. And then of course she'll back up and do something and do some work. But I cannot come is something that you learn from Nitya. So this was happened, and a meeting happened, something happened. And then, is this the next slide? Oh, okay. Now this is big trouble. Absolute, unadulterated trouble. Apoorva Pauranik. Now read that line here, okay? He has Moscovified me so much that I now have hypercholesterolemia. Really, Apoorva. Now, the other thing is, I am Anvita's father. Now, if Apoorva is so much trouble, Anvita cannot be less trouble. So she joins radiology, first day, first show, okay? I make them sit in front of me. That is the only time they get to sit in front of me, otherwise they have to stand. They're all sitting, 5, 6 girls, boys, whatever, and each of them I ask, why did you take radiology? Why? No one tells the truth. The truth is, easy subject, no calls, lots of money. No one tells that. And Anvita is the only a person in 40 years of being a radiologist who has told me, she looks at me in my eye like this and says, I like photography, therefore I took radiology. Can you believe it? First day to a first show, 24-year-old girl has no hesitation in telling me the truth. Apoorva, what should I do to you? Anyway, so she then is the girl whose father is Apoorva. Then Apoorva came and met me, and all my troubles started, honestly. So he and many others up north worked with Humanities, and things happened. But it came to haunt me again a few years later, I think. I get a message or was an email. He said, I am following this society. I mean, I have phenomenal administration for this man. Phenomenal. Because he is so meticulous in what he does. And he carries forward what he does. And whenever a man is so perfect, there has to be a woman behind it. I promise you that. You take all the power, Nirja is quietly sitting at the back. Well, I've seen it often. I mean, I'm not joking. It's serious stuff. When somebody is so perfect, he has to have support from his wife or the other way around, which is less often. So he then said, I am forming this academy and we are going to give an award every year. I said, very good, chance milabi. And the next slide. I want you to be the part of the selection committee. It's a standard idea, old time-tested idea, that when you don't want to give the award to somebody, you make him a part of the selection committee. I said, Apoorva, I know all your ideas. Next time he says, Dr. Sunil Pandey is not there, will you be a chairman of the committee? Means you have no chance at all your life to get the award. Apoorva, please note, institute another award. Okay. Now, all that happens, and therefore, 4-5 years this goes on. Year after year, systematically around. I mean, you cannot imagine how methodical this man is. You showed all his work. Busy neurologist doing all this. He cannot be an ordinary man. His daughter, Anvita, is not an ordinary woman. Every month, every other month, in the most leading journal of neuroradiology, she's a neuroradiologist in Canada. She is both academic and on the patient care side. She has pictures in AJNR. The photographs, I mean, there's a section called interlude there, and she has photographs in that leading journal of the career that she has thought of as a secondary role. Why am I saying this? This is all passion. You cannot do something like this or anything at all without passion. That is the passion that makes him get all these books here. It's a joke to do all this. Buy them, order them, have them transported, come here on a rainy day and trouble us. It's not easy. So, whether I like it or not, and I like it a lot, I want to thank you and I want to thank Nirja for not that you gave the award to us, but for thinking up this thing. Adding this headache to your rest of the world, forget the money part of it. I'm not even talking about the money part of it. Just the mental exercise that goes every year to make this, and the concept that you should give something to promote the award. Now, then what happens in the next slide? This is Padmaja. She's another gone case. So in 2010, after receiving my mail, I think she sits down and makes a big list. I mean, it goes double this. And if you go through this, at that time in 2010, 15 years ago, she has thought up everything in a few days of all that is to be done. Even she won't be remembering that there is a mail like this. I'll trouble you with all that mail. You're supposed to do all this. So anyway, she had done research on that, And there's no wonder that she's leading the team now. In the sense that the grandmother is sitting there. You know who's grandmother? Lopa Mehta. Once upon a time, she used to be the mother to the students. Now she is grandmother to the students. Anyway. So all this was done by her, and I think, what's her name? What's her name? No, you know my name. The other lady who's working with you. You. You know, when you have temporal lobe atrophy, you have nominal aphasia, among other things. Swarupa, okay. So Swarupa, so you'll excuse me. If you do an MR on my brain, you will see that my right temporal lobe is almost black, full black. The uncus is gone. So how do you think I remember names? Anyway, so this is what she had done at that time. And somewhere along the line, the Vice Chancellor got, okay, now the real thing starts now. 2014, I made this slide just because I wanted the numbers right, because I can't remember dates and numbers, just the opposite of Lopa Mehta. Ask Lopa Mehta what day of the week was 1927 Thursday, 17, she will tell you. You heard what I said, Thursday, 1917. Manu Kotari was an examiner like this. He'll give the humerus to the bachu and say, this is the humerus. What is the name of this bone? I am not kidding, okay? And he'll give 40 on 40 that to the poor girl. Anyway, so during that time, I mean, you have to understand that I was so influenced by Manubai Kotari that he was a walking, talking influence on me. And I was sitting there in that lecture hall in the MLT and I said, what do we do? When we can create an oration, there are orations and orations. Once in a year, somebody talks, somebody listens, so on and so forth. And I said, why not create a chair? The concept of chair is a Western concept mainly. That is a position that is occupied by a person of great repute who will proceed further in motivating others to carry on that work. That is the concept here. So chair is not exactly a chairman. It's not just a chairman. It's more than that. So at that time, I suggested that we should have a chair of medical philosophy. Not in the institution, I don't know exactly what happened, but medical philosophy became medical humanities, more or less the same thing. And the chair of Manu Kotari chair and division of medical humanities was created. Lopa, am I right? The word and division, it's both, not just the chair and division. Now what happened after that, I do not know. I exactly don't know, except that I know that there are many functions being held and there are many people contributing to that. I told you some names. I don't want to take out all the names here, but where one name, and that is the most important name, according to me, are the Bachulo. Students who year after year conducted programs based on medical humanities. They organized conferences. They did things that have nothing to do with their syllabus. They did things that have nothing to do with their marks. But they did it out of their volition. And that is a rare phenomenon. So if today I want to give credit to what's going on in the MH cell in KEM, it's for the Bachulo and their grandmother. So the grandmother sits there and just encourages them to do it. But the actual donkey work is done by the student. Therefore, I am very hopeful that this work will continue, whether she is there or not, whether Padmaja is there or not. Like Apoorva and what is the other one? Avishkar and Apoorva. This will become a tradition by itself, and it's on firm ground. With that positive note, I will stop. Thank you very much.